A major disruption is unfolding in Maryland's healthcare landscape as Johns Hopkins Medicine has abruptly ended contract negotiations with UnitedHealthcare, leaving tens of thousands of patients in a precarious position. This sudden breakdown affects approximately 60,000 individuals who now face the daunting choice of either seeking new healthcare providers or shouldering the full cost of their medical care out of pocket. But here's where it gets controversial. The fallout from this split raises serious questions about the stability and accessibility of healthcare networks in today's insurance-driven system. For months, Johns Hopkins Medicine and UnitedHealthcare were engaged in talks to renew their contract, which would allow patients insured by UnitedHealthcare to continue receiving care within the Hopkins network. Unfortunately, these discussions have collapsed, and the consequences are immediate and far-reaching. Patients who relied on this partnership for their medical needs must now scramble to find alternative providers covered by their insurance plans or risk paying expensive medical bills themselves. This situation highlights a growing tension in the healthcare industry, where negotiations between providers and insurers can directly impact patient access to care. When such agreements fall apart, it's the patients who bear the brunt, often with little warning or support. For example, a patient undergoing ongoing treatment for a chronic condition might suddenly find their trusted specialists out of network, forcing them to either switch doctors mid-treatment or face significant financial burdens. The Johns Hopkins Medicine Network is renowned for its high-quality care and specialized services, making this disruption particularly alarming for those who depend on its expertise. UnitedHealthcare, one of the largest insurance companies in the country, also plays a critical role in providing coverage to millions. The failure to reach a new contract agreement between these two giants underscores the complex and sometimes fragile nature of healthcare partnerships. And this is the part most people miss. While contract negotiations might seem like behind-the-scenes business dealings, their outcomes have very real, tangible effects on everyday patients. It's a stark reminder that healthcare access is not just about medical advancements or hospital quality, it's also about the intricate dance between insurers and providers. As this story develops, many are left wondering, should patients have more protection or say in these negotiations? Is it fair that such critical decisions are made without direct input from those most affected? And what does this mean for the future of healthcare accessibility in Maryland and beyond? We invite you to share your thoughts. Do you believe insurance companies and healthcare providers should be held to higher standards to prevent situations like this? Or is this simply the inevitable result of a complex healthcare system? Join the conversation and let us know your perspective.